I'm
Yeah,
glad to be joined by Dr. Paul McCarthy. So, Paul, just talk to me about sports psychology itself because it's still quite new to a lot of people. And what does it actually mean? What does it entail?
yeah. Well, I guess historically it's probably going back over 120 or 30 years now, but in terms of its modern era, we would probably see it has developed a lot in the last 25 years and maybe the last, 10 or 15 years of the previous century. And sports psychology, really, a bit like psychology, we're interested in mental process and behavior. And we're interested in that as it applies to the sport contexts, athletes, coaches, and teams.
Yeah, and sort of what have you found in the years that you've been in the field? What have you found has changed and developed over time?
Yeah. So I guess several things have. The field remains relatively small across the globe. We have, in the UK, for example, 400 plus qualified practitioners who are HCPC registered. Now, as a field, that doesn't really mean there's that many of us, but there is a mushrooming of undergraduate, postgraduate, and training programs now. So we'll see some taught doctorates and some professional doctorates. They're slightly different in terms of the training routes, but there are more opportunities and different opportunities that suits people's needs depending on where they live.
Yeah, and in terms of issues themselves, have you seen anything sort of crop up in maybe the last 5 or 10 years that you might not have seen when you first got into the field?
Yeah, I think in a lot of what psychologists are doing, they are dealing with well-being. They're also dealing with performance. They're dealing with that crossover. And it's not necessarily that the issues are changing, but it might be that there are greater complications because there's greater investment of time, money, and resource. And that would be at a familial level, so within their family, at an organizational level, and at a personal level. So they might be doing more for longer with greater commitments. And the professionalization of sport as an entertainment industry means that the systems are beginning a little bit earlier. They may be going on a little bit longer in terms of people's careers. And within those, there is a greater complexity, of course, because of all the systems to help somebody get to where they want to go.
Yeah, and I was going through some of your research and there was a bit of a focus on student athletes. Is there sort of a different way that younger people are dealing with mental health?
Yeah, and of course, we see a lot more research, a lot more media attention, a lot more time spent acknowledging the presentation of mental health issues. And part of the difficulties with that is to understand, by definition, what do they mean in terms of assessment and diagnosis. Are we feeling sad, a little bit down with the natural upheaval of everyday life, or is it something that needs medical treatment? And perhaps for the everyday person, that's very difficult to understand. And the acknowledgement of mental health, mental well-being is, of course, immensely valuable. And yet at the same time, it brings in a lot of issues regarding assessment and treatment.
Yeah, and you talk about sort of that awareness of mental health. Obviously, my project is focusing primarily on football. Have you noticed sort of a change in how mental health's acknowledged? Is it more open?
Yeah, I guess at several levels there are a greater presence of different health professionals within the professional football environment, so attached to each club. There's a greater acknowledgement amongst the Professional Footballers Association. There are more outlets for support. Again, there are psychologists present within the club environment. There are psychology departments or welfare departments in terms of the player care and so on. So the systems are evolving to offer the greatest support they can while those people are within the club system. I think part of the issue, of course, is when players are outside the club system, what exactly is their system of support because they may have reached a certain point, the club have or don't have a place for them in the next year. And because of that, a player is trying to figure out not only the transition, but also the process of loss of status and identity and understanding and friendships and so on. So there's probably a lot more going on there that can adequately be dealt with by any one person, and a more systemic organizational approach is probably what we need.
Yeah, and you sort of mentioned there about that loss of identity. A lot of people I've spoken to throughout this research have sort of said that when they've closed, their playing chapter, they have felt a bit lost. Sort of they've lost their whole, as I say, identity. A lot of them are just used to being so and so, the footballer, and then they come out of the game and it's, they're just so and so.
Yeah.
Have you, has that been an issue that's cropped up a lot for you?
Yeah, and it has at various levels. And some people, they are normative transitions. So they're coming out of the game at the end of their career. Some are non-normative. They are getting injured or career-threatening injuries that have meant they can't progress as they would have liked. And at one level, we can look at the industry as a source or a process, a bit like maybe not like a school system, but the people have a time and an opportunity to be in that system, and they may not make it all the way through to the professional ranks or to have a professional career. And perhaps that all the system can offer is an opportunity to develop certain skills within that time frame. And then afterwards to know that this has been a part of my journey and there are other opportunities or alternatives for me. And perhaps, and I know a lot of clubs, this is what they do. They're establishing those pathways both for education and post-career, career and retirement and so on. So they have given at least the indication that we don't know what will happen in this person's journey, but we're acknowledging what they need while they're here and acknowledging what might be in their best interests
Yeah.
post-retirement or post-career.
Yeah, and again, another issue that, well, something that's cropped up a lot is players actually sort of struggling to go out and, and reach out for support. Is there sort of, not sort of advice, but what sort of could players do, or what sort of systems could be put in place to make these athletes more comfortable in actually seeking, mental support?
Yeah, and I think a lot of what is happening with player care systems, with psychologists being present and embedded within clubs, is that they have opportunities to understand the provision of psychological support. And it may be a case that it's a stepped care model, that they gain education at the beginning. After the education, they have the player care. After player care, they may see a psychologist for any presenting issues. And then once those are dealt with, they may go back down that stairs again, back towards player care or back towards psychoeducation. They don't necessarily all seek or need treatment, as it were. But that orientation and facilitation means that normalizing the presence of support is helpful, not just now, but at any stage within somebody's life. And most of the work that psychologists do is simple, practical support, helping the client to understand themselves, their situation, their problem, and to be able to work with it in a way that gives them independence and choice about what they do with it and where they go with it.
Yeah, and sort of, are there any issues, there could be a various number of reasons why someone might be struggling, might be injury
Yeah,
or performance. Is there something that sort of comes up quite a lot in your experience?
yeah. Well, working with players, if it is over a longer period, like a lot of players will contact about one issue in particular, but injury is a good example. It might be 3, 6, 9 months of, injury rehab, and working with them will present different challenges compared with somebody who's dealing specifically with performance. But it's not necessary that the issues presented are changing. They are issues that are both relational. They're to do with the self. They're related to performance, recovery, and so on. But it certainly is about how we can establish good working relationships and having psychologists in environments with the onus, I guess, is on them to present themselves, their skills in a way that allows the football players to feel comfortable approaching them. And of course, that one person isn't the solution for all people, but several people may be. And trying to establish a core set of values about the work that we do and how we do it, and the personal stance we hold, means that there's a sense of humility, non-judgment, openness, trust, that when you step into the room with the psychologist, that's what greets you.
Yeah, and you say there about that comfortability. Do you find that, I think in sport, especially in football, we still sort of have this, macho sort of vibe, it's sort of there's a big stigma around mental health still. Do you find that these
Yeah,
athletes are comfortable or
I think certainly more so. We have a greater range of athletes coming from different cultures, different experiences. They're keen and eager to learn. Many of them are just trying to, in their own words, survive the system, because of the demanding nature of it. And when we see it in that holistic context, that this person is in this environment dealing with these challenges, we can take what are their strengths with a strengths-based approach, understand their culture, their personal history, and make sense of it with them in a way that makes sense to them. And that's why the work that we do is really, it is client-led. We're going where they need to go.
yeah, and I just want to get on to, the practice you've set up with a good athlete. Just sort of talk to me about that and, what sort of comes with it.
Yeah, so my own private practice is serving athletes, coaches, teams, parents across the world. Um, my private practice aligns with my research and my work at university, which is training psychologists to become qualified in their field. But the private practice is a way of giving back as much as I can to the people who are in the community doing the work that they are doing. So if we're talking about coaches and backroom staff, but specifically with athletes, it is helping them through performance slumps, maybe personal issues that they're trying to rectify that are within my competency, and from there establish good intentions in relation to sports psychology. Because what I say is that although you can dismiss me as a sports psychologist, I would encourage them not to dismiss sports psychology as a support system.
Yeah, and then, you mentioned there about sort of, the families, the parents. That is sort of an aspect of football, I think, that goes quite unnoticed, sort of the commitment and sacrifices that the families put in. Is
Of
there sort
course.
of an effect or something that maybe comes up a lot in that
Yeah,
regard?
well, within those family systems, there are commitments that may begin relatively small and they increase as people go through young childhood or into young adolescence, late adolescence. And many of those commitments are both time and money, but they're also social and emotional because they're carrying with them hopes and expectations and fears that the child has, and they want the best for them. So, at a systemic level, there's a lot going on there. And we often can't see that effect until maybe further down the line, where there are siblings or there's a priority to get, Jill to training because she's going to make it as a professional footballer, but Jack, he just plays tennis with his friends. There's a commitment that's there in that entertainment industry about what needs to be given at what time across a long period. And without parents, there isn't any sport.
Yeah, and I just want to go back to one of the earlier points, talking about mental health literacy in, in these sorts of environments to actually make people aware from a young age. Is that something we're seeing more of, do you think? Do you think academies are doing
Yeah,
a better job?
yeah, they're certainly oriented towards them. And if you think about it, there's a duty of care, of course. And yet at the same time, the club only survives if they stay within the league. And if they drop out of one league into another, there may be redundancies or changing of the systems. So you say, what keeps the club alive? Well, winning does. And yet at the same time, what keeps the club alive in terms of the people and the backroom staff and all of the football players, they need time and support. And again, that time and support depends on their position in the league. It's a very difficult system to be working in because we need to win in theory to survive. So you have this output that is necessary, and a lot of investment is aided and pressed in that direction. And yet at the same time, the people who are in the system are making that happen. They need needs met, they need support services, and that is a delicate balance.
Yeah, and you say there about sort of that, they need to win to survive. Is that something that again comes up a lot in your experience where players actually put quite, an unnecessary maybe priority on winning and
Yeah,
performance?
I think at a global level, they understand the importance of winning, about personally, professionally, broadly for the club, family, environment, and so on. I that is their intention. And yet at the same time, they have their contracts and some of their independence, which means that were the club not to do so well, they may not be adversely affected. Now, some people are not in that dependent as you go down the football pyramid. That changes, but for a lot of people that I see, there's a greater independence there. So they have good lives in that sense, maybe financially secure, and present a very different set of issues compared with somebody who's, further down the football leagues. Yeah.
Yeah, and sort of just to sort of close out, is there something you want to see maybe built on more in the field? Is there something in terms of from a research standpoint that we should be looking more into?
Yeah, well, I think not football as its own industry gives us an opportunity to look, say, from a psychological perspective about childhood, adolescence, young adulthood, older adulthood. It helps us to look at the lifespan. It helps us to look at a range of dimensions that are not just related to sport and performance, but it's about the fans. It is about the effect of, sport in their lives. And when we look through all the literature, you can put these pieces of the jigsaw together. But if we said what are more sustainable systems, well, those are probably there in the system as in that we can get to sustainability, but promotion, demotion in the leagues probably makes that, a central part of what is a feature of systems in the UK. But at the same time, it also has detrimental effects for financial stability, which is again eroding a lot of the good work that's being done simply because the finance isn't there. So I guess if the money was spread differently, we would be able to, not necessarily a franchise system, but we would be able to at least establish um, some six financial security across the 92 clubs, as it were.